Hello and welcome to the EduTalk series hosted by Biotone EduPartner Program, and massage industry experts. As massage schools, students, and practicing therapists have met the challenges presented over the last several years, the EduTalk series hosted by Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Stephanie Lynn Hall. She's a massage therapist, dietitian, and nutritionist, yoga and Pilates instructor, and owner, educator of Fox Valley School of Massage, Reflexology, and Feng Shui. She is trained in both Eastern and Western healthcare with focus on relieving pain, stress, sleep, and movement issues with reflexology. Let's listen and learn as Stephanie Lynn discusses reflexology to improve health and well-being. She'll explore the differences between reflexology, auriculotherapy, and I had trouble with that word earlier. So auriculotherapy, acupressure, trigger points, and more. She'll share how to locate points for pain and stress, plus present helpful self-care techniques to share with family, friends, and clients, and yourself as well. Thank you for joining us. We have a lot to cover tonight, and Stephanie, I'll turn it over to you, and then I'll see you on the other side.
Well, thank you so much for that introduction. So I will share my screen, and it is just giving us a little moment here to get it into the full screen. So here we go. All right, everybody, thank you so much for joining. I'm really excited to have everybody here and to just talk about some really fun things that are maybe review for you, maybe new for you, and just to take this time together to explore. So I also want to just take this opportunity to thank you, Donnell and Biotone, because this is a really amazing series that we're all able to take part in and share knowledge and spend some really wonderful time together. So as Donnell said, I'm Stephanie Lynn. I own a massage therapy school in Wisconsin. I have been studying health and wellness most of my life. So I really love doing presentations like this. And I like to just pause for a moment and let you know that while I realize people are attending from, many different states, that here in Wisconsin, where we're located, schools are regulated and our curriculums are approved. And so it's nice for you to know that, because if you choose to do any learning with us, you know that it's vetted education and that it's going to be really good quality for you. And then before we get into the information, it's important whenever we're doing a presentation, especially something where we don't have direct contact, to just pop in that medical disclaimer that, again, our presentation is for educational and informational purposes only. It's not construed for medical advice. And obviously, we always want to check with our healthcare practitioners before beginning something new or implementing new techniques. So with all of that said, let's take a look at what we're going to talk about and what we're going to cover. So we're going to look at reflexology and microsystems. We're going to look at auriculotherapy, acupressure, trigger points, and tender points. And then once we're all on the same page about what all of these things are, we're going to learn how to implement them for ourselves, for clients, and to be able to share. So we're going to start with reflexology. So if you're familiar at all with reflexology, you know that this is a modality that has been practiced for thousands of years. And I really love this illustration. It's found in a lot of reflexology books, a lot of massage therapy books, because it's from Egypt dating back to 2330 BCE. So while we're looking at some of these modalities and talking about what these things are, well, maybe Western medicine has a hard time with our current research protocols always showing that these things are effective. mostly because we just aren't familiar with that perspective of how to show it works. We've got thousands of years of anecdotal evidence. And so we know that people are utilizing it and have gotten benefits. So when we talk about reflexology, we need to look at what is reflexology, because so often when we say that word, the only thing that comes to mind for people are feet. And that's okay. We love to do reflexology on the feet, but really it has to bring us back into what a microsystem is and then where we find all these microsystems so that we can then use reflexology. So one like a simplified definition would be stimulating one part of the body to have an effect on another part of the body with the goal to bring balance or homeostasis. So when we look at the picture on the screen, we can see that we have a foot overlaid on the human body. So if we know our anatomy, whether we're looking at feet, hands, or ears, we then know where to work on that particular reflexology area to have an effect someplace else. So when we talk about reflexology and we say we're working reflexes, it's important to know these are not the reflexes when you go to the doctor, when they tap your patella or they tap your Achilles tendon. These reflexes are stimulating this point here per se to have an effect on the heart or the lungs. So that's what we mean when we say we're overlaying it. So we talk about all these reflexes. We say that they're in these microsystems, referred to also as microflex areas. So while the foot is what might come to mind for a lot of people, these microsystems, so representing the whole human body in miniature on a small part, we see this on the feet, we see it in the hands, in the ears, in the eyes, and the tongue. So I like to start with this picture because most people are familiar with it, and it really breaks it down into really how simple we can keep reflexology, especially on the hands and the feet, and work it into your sessions with clients. So when we talk about reflexology and we say we're working these reflexes, we're working the reflexes within microsystems. And the microsystems, as we just said, are found in many places on the body. So it's important to just take a pause or a moment and then say, okay, if we can replicate the human body in lots of different areas, we're going to give each of these areas their own individual name or modality so that we have consistency in the terminology. So it could be defined a couple different ways, but for us tonight, when we're talking about reflexology, we're going to keep that to the feet and the hands because most reflexology courses teach the feet and the hands. Some may teach the ears, some may not. So when we say auriculotherapy, we're talking about the ears. Iridology, we're talking about the eyes. Now, when we are working the feet and the hands in particular, we want to think about not only are we having this reflex effect where we're stimulating a point on the foot or the hand to affect another part. So we're going to look specifically at the adrenal gland point tonight. But if you think about massage and body work, we're also going to be having direct effects because when we're working on the hands and the feet, we are working on the bones, the muscles, moving the joints, moving the lymphatic fluid. So it's really amazing when we're doing a hand or foot massage, indirectly, we're kind of doing reflexology. And when we're doing reflexology, we're also getting these direct effects. And that's really, really powerful because it's really stimulating to the parasympathetic nervous system and helping people to relax. So I like to, when I'm talking about reflexology, auriculotherapy, just remind us all of the different ways that we're causing and the body is experiencing effects from our touch. So as professionals, it's important to then say, what's the difference and does it matter with our terminology? All of the techniques we're talking about tonight are trying to bring balance or homeostasis to the body. So the words and the titles give us that clarity of where we're working. I don't want us to get lost in the words, but I also want to make sure that we're being respectful to everybody that's practicing these modalities. So sometimes when we're talking with other professionals, they may really insist on those differences. And other people that utilize a lot of modalities will allow the names to flow. So we always want to be conscientious that we're not offending any practitioner or professional. So for this presentation, so for tonight, how we're going to use the terms is, again, reflexology, the points or areas on the hands and feet. Auriculotherapy, the points or areas on the ears. Acupressure points, those are the points that are found along the meridians. So this is where we get to start bringing in a little bit of our Eastern medicine and our Eastern philosophy into our health and wellness. And then trigger points and tender points. So trigger points, tight areas of skeletal muscle, so within the sarcomeres, that are referring pain to predictable parts of the body, versus tender points, which are also tightness within the sarcomeres, but not referring pain. So hopefully just taking some time to kind of look at the vocabulary helps us to be on the same page as we now look at each of those individual modalities. So reflexology. When we talk about reflexology, the human body represented, again, on an area of the body. In this specific case, we're talking about the feet. So I love this picture because anatomy and physiology is my passion. I love teaching anatomy and physiology because once we understand how the body is put together and how it functions, it translates into so many modalities. It allows you to decide if you want to learn a new modality, because if you read the description of what somebody's teaching and it makes sense with AMP, you know it's probably a good fit for you. And if it doesn't, you might either choose to explore it or decide it's not a fit. So when we look at the body and we look here, we have the shoulders. So we're going to call this the shoulder line. Right about here is where our diaphragm is located. Our anatomical waist, where the body goes in, and the pelvic line. So if we take the body and we simply translate those lines onto the feet, the shoulder line at the base of the toes, whatever we find in the body above the shoulder, that's what's located here. So on the toes, that's going to be the head. In the thoracic cavity, the heart and lungs. So we have the heart and lungs. Abdominal pelvic cavities, abdominal pelvic. So again, we can study and learn reflexology and the history and the philosophy. Once you know the anatomy and physiology of the body, you know it on the foot. So that introduces the overlay. And then we can take really the same picture we just looked at, but fill it in with the organs so that now we see that direct correlation from the body with it filled in on the feet. What I like to say also at this point is, as we now look at charts and as you look at books, sometimes when we're learning reflexology, we think because the colors are different and some of the patterns look different, that maybe the representation is different. But again, if I understand A&P, I know the heart and lungs are here, whether it's in this color diagram here or same thing here. So once you know that A&P, you can overlay it onto the feet, onto the hands, and then you can really start to hone in and be really specific with where you're working. So both of these charts are saying the same thing, just with a slightly different color representation. So then we can also take reflexology to the hands. Some people don't like to have their feet worked on. That's okay. Some people don't like to have their hands. That's okay. The beautiful part about all of this is if we work either the hands or the feet, we're still affecting the whole body. So as we look at the hand, again, we're going to see the shoulder line, the diaphragm line, we have our waistline, and we have the pelvic line. So again, anything above the shoulder line, the head, are on the fingers. So these two charts are showing the same thing, just again with different colors. So if you're really fascinated with reflexology, you can just start drawing a picture like what we showed here. You can then, these have zones just to make it a little bit more specific. But if you start with this, start coloring it in, you have your own charts that then you can use when you're working with your clients, working on yourself, or sharing what reflexology is with friends and family. So now we're going to look at the ear. We're going to look at auriculotherapy. So we now still have reflexology, if you will. Auriculotherapy, like reflexology, has been practiced for thousands of years. The difference is how we kind of lay the body on the ear. So you see here, we have a fetal position. So the baby, the head is on the bottom and the whole body. So if I want to work a headache out, we're going to talk about headaches in a little bit. I'm going to work the earlobe. So we definitely have reflexology. And so some reflexology programs will teach hands, feet, and ears. And then some will not only teach the reflexology part of the ear, but also the Chinese acupressure points of the ear. And then some courses of auriculotherapy will only teach the Chinese parts, but not the reflexology. So it's really exciting, and you can really decide what you want to learn and incorporate. So we'll take a step back for a second and go, well, what is auriculotherapy if that's new to you? If you're not working your own ears or your client's ears, hopefully after hearing this, you'll want to start right away. So auriculotherapy or ear therapy, according to the World Health Organization, the ear is the most studied microsystem of the body. I find that fascinating because when we talk about reflexology, again, usually the foot comes to mind. And here the ear is the most studied. It's been taught for over 4,000 years. So working our ears has profound impacts for the whole body. So again, auriculotherapy can then equal ear reflexology and or ear acupressure, depending upon the practitioner's training. So as we saw, ear reflexology, the body is represented on the ear as an upside down fetus. So we can use the same techniques that we use on the hands and the feet, kind of using our index fingers and thumbs on the ears. Ear acupressure or acupuncture is a stimulation of those specific points on the ear. And these are then sometimes referred to as auricular points. So ear acupressure points can be stimulated by massaging the ear, by pressing points on the ear with our fingers or probes, or if we want lasting effect, by placing what are called ear seeds or pellets on the ears. And it's important for us to remember that while acupressure and acupuncture points are the same, unless we're a licensed acupuncturist, we cannot use needles. We still can stimulate the points and we can stimulate them for a prolonged time period with ear seeds, but we can't place needles. And when we look at the ear from an acupressure standpoint, there's over 200 points in the ear that again help with stimulating and balancing both physical and emotional conditions. So this picture is really nice because it's showing kind of what we already saw, but picking one of the body systems out. So we could, on an ear, we could show, as shown here, the skeletal system. We could show the muscular system, the endocrine system, just, taking one system at a time. And then depending upon what's happening for somebody in their own body, then determine what points to use. So if you are really intrigued by auriculotherapy and want to really just dive in and learn all there is to learn about auriculotherapy, this textbook is really helpful. But I will tell you, it is written very, intensely. It is a hardcover textbook, but I have it in my arsenal of tools because in that textbook, they'll tell you protocols of points to use on the ear to help with any condition really you can think of. So if there's a backache or if there's low energy, if there's, we're going to talk about a diet point in a little bit, that book has it. So just like when we talked about the hands and the feet, I like to point out that auriculotherapy also has direct and reflex effects. Those direct effects, again, are when we're actually massaging the ear, we are stimulating blood and lymph flow. So we're working what's anatomically there. We know the vagus nerve is right within the ear. This is one of the few places that we can directly stimulate the vagus nerve. So many of us are taught in craniosacral and myofascial, beautiful hand positions on the chest, but let's not forget the ear. And then also the lymphatic system is right up there if you've studied lymph drainage. So the ear also can have all these profound effects. And when we combine them all together, it's amazing. So I mentioned that for stimulating the reflex areas or the points, we can use probes or ear seeds. And so some ear seeds are going to be very tiny, so we won't even see them on the ears. And then you can get them where they're a little bit more decorative. And so it becomes wearable, functional jewelry. And then just a couple other places in the body where we have these microsystems, the eyes, our iris. So many of us consider, the colored portion of the eye as just what color are our eyes? And then we kind of don't look beyond that. But the eyes also can give us a clue as to what's happening in the body. So when we study the iris, that's referred to as iridology. And there are charts and there are books that you can purchase so that you can take pictures of the eyes and then start to look to see where that iris isn't consistent within its color or consistent within the striations. And then the tongue. And the tongue is fascinating because, again, we have a microsystem here, but also from Eastern studies, we know that often when you see an acupuncturist, they'll have you stick out your tongue so they can look at the coating, they can look at the shape, they can see if there's bite marks. So many different parts of the body really do give us clues as to what's happening. So we've talked about reflexology, auriculotherapy, another modality for thousands of years, acupuncture, acupressure. So when we talk about acupressure points, we're talking about points that lie along the major meridians. So points that run along the lines, those lines being called meridians. With acupressure, often more than one point will be used, but there are some points in the body that we can stimulate just one at a time. And we're going to share a couple of those points tonight. So now, if you're interested in learning more about pressure points after this presentation, this book is wonderful. This is not textbook like the auriculotherapy book. This is more of like a how-to. You have a cold, here's what acupressure points you should use. You have some sciatic nerve issues, here's some points you should use. So if this isn't a book that you have in your library, it's a great book to add in. And then because so many of these points overlap, when we're hitting a reflex area or an acupressure point, often that is also where we have not musculoskeletal, but muscular tightness. So when we really start to study marma points, acupressure points, trigger points, when you lay all of the charts on top of each other, many are in the same spot or very closely related. So that's why I feel like it's so important to touch base and bring all of these together. So trigger points, most of the time, if we've studied trigger points, you're familiar with Dr. Janet Travell and Simons, because they really have brought this into the limelight for us to be able to make our body work so much more efficient and effective. So it's newer, relatively speaking, to things that we've already discussed. Dr. Janet Travell coined the term trigger point in 1942. So compared to our other modalities, that's pretty recent. But with that, she used that term trigger point to describe those hyper irritable spots that can be felt as nodules in our muscle tissue when those sarcomeres, that's a whole nother discussion, right? But the way that sarcomeres work, if they don't relax and they stay taut, we can feel that as we're palpating muscles. So what she noticed was that pain caused by touching and pressure on that trigger point was also radiating from that point of origin to a noticeable pattern. So Dr. Travell outlined diagnostic criteria and treatment protocols that we've modified slightly, but that we still use as our foundation today. And working with Dr. Simons together, they mapped out almost all of the trigger points in the body and those associated zones of radiating pain. So if we maybe forgot about these trigger point charts in our treatment area, I would really encourage you to revisit that, because one of the things that we know is that when people come in with pain, very rarely is the area of the body that hurts where the pain is. So often people are like, oh, my hand hurts. But when we look at our trigger point charts, we could instantly be like, okay, it might be in the hand, but is it a trigger point in their latissimus dorsi? With all the sitting that we've been doing and rounded forward posture, if we, of course, address the pain in their hand, because that's where they're feeling it, but then go check for that trigger point, we can often alleviate people's pain so much faster because we're not hunting and pecking. We're going, okay, where's your pain? Where are trigger points that refer to this area? Let's just check it out. So when we think about trigger points, they are an area of muscle tissue that feels tight, and when pressed or stimulated refers to another body part. Versus tender points, an area of muscle tissue that still feels tight, but when pressed doesn't refer. Now, there is a little discussion about that because of individual variation. Sometimes people aren't in tune with where that pain is radiating, and that's okay. But for our conversation, that's how we want to identify the two. But then also, one of the big advances in treating trigger points and treating pain in the body is that we really need to step back from causing more pain and tightness. So it's really important when we look at all of the new research from the fields of physical therapy, occupational therapy, athletic training, and massage therapy, NMT work. We used to be taught that when we would press on these trigger points or tender points, that it was okay for people to maybe on a scale of 1 to 10, be at a 5 to 7. All the new research is showing that they should really only be at a 3 to 4, because if we're using too much pressure, we cause those sarcomeres to stay tightened and maybe more of the sarcomeres to join in that tightness. And now we're causing more and more pain, spasm for our clients. So the good news is less pressure, easier for us, more effective for them. We might need to hold them longer than the 10 to 12 seconds we were taught before, 30, 60, 90 seconds, up to 2 minutes. And if we're not using so much pressure, that becomes doable. So now that we have looked at what all of these things are, how do we incorporate it? How do we integrate it into our lives? We're now aware of all the points in the microsystems. We want to use those to relieve pain and stress for ourselves, for our friends, families, and our clients. So I want you to know that using your hands, pressing things the way that is comfortable for you works, and it works really well. Now, obviously, if we study these modalities we've talked about individually, we can learn specific techniques. But for tonight, I don't want that to be a barrier for you. I want you to feel like you can take this and start using it. As long as you keep in mind that on that pain scale of 1 to 10, we're keeping our clients at a 3 to 4, and that we're helping people realize that no pain is not no gain, that in fact, it's just the opposite, that if we overstimulate points, we're just going to have more and more pain. And maybe you've seen that in trying to treat your own points and or maybe working with your clients. So if we have issues with our hands, if they're not, we have got maybe issues with our thumbs or index fingers, or you're sharing this with other people, we can use tools to stimulate points and to release trigger points and tender points. So all of these tools can help aid in our effectiveness, but they're not necessary. They don't have to be a barrier of entry. So I'm just showing you on here some hand tools, some tools that you might find if you take an NMT course. And if you have stones, if you're already doing hot stone therapy, or maybe you were, but now you're not, and you still have your stones. Stones are awesome tools, even at room temperature. And they allow us to not have to grip our hands and maybe stress our joints as much. Kinesiology tape. If you're not using kinesiology tape, that might be something fun for you to dive into and look at. You're working with your clients in the treatment room, but what can you do that they can then carry with them outside of the treatment room? Kinesiology tape, ear seeds. Foam rollers are wonderful. I'd like to reiterate our point about keeping that in that scale of 3 to 4, instead of maybe rolling on things that are pointy and jagged and that are potentially damaging muscle tissue. And then tuning forks. Sound therapy is so huge right now, and you can get tuning forks that are look like the normal forks. These that I'm showing you here are actually weighted tuning forks. I use these in my practice because when you stimulate them, you can put them on a point and the vibration will transfer down into the body because of the weights that are at the end. So let's get into application techniques so that you feel like you can integrate what I'm sharing with you tonight. So I share this slide now, and then we're going to come back to it at the end, because we are going to talk about stress management with the adrenal gland. We're going to share a little bit about auriculotherapy and the appetite control point, movement, sleep, pain, and breath. when I sit down and I'm coaching a client for whatever it is, I always hit these 5 things. So that's what we're going to go through together now. So when we talk about stress management, hopefully we're always reminding our clients to breathe, and we're breathing ourselves, but also the adrenal gland, because we know that when we're falling into those stress patterns, our adrenal gland is getting really fired up. So a lot of times what happens when we find that adrenal gland point on the hands, the feet, and the ears, it can be a little bit tender. So we get to go back to, again, anatomy and physiology. So here's a body. We know that the kidneys sit at the back. The adrenal glands sit on top. So we've got our line. So we've got our diaphragm line. We've got our waistline. We can follow that over onto the foot. And here is where the adrenal gland point is. We want that foot to be relaxed, not stretched back, because that longitudinal line is indicating a tendon there. We don't want to put a lot of pressure on that tendon stretch. So you'd want to keep the foot relaxed. And maybe as I'm talking, go ahead on your foot, if your foot's handy, or your hand as we talk, see if you can find that point. So we can just simply use our thumbs. We could use our index finger. We can use knuckles to stimulate. If the point isn't sensitive, then we would just keep going. If that point is sensitive, then again, keeping that level of discomfort, if you will, to a 3 or 4, and we can stimulate it until it kind of feels like it relaxes. Now, again, our reflex effect is we're touching this point to try to stimulate the adrenal gland in the body, but also notice where this is. Right in the thenar eminence, right where a lot of people have pain, right where when these muscles are tight causes restriction of movement of the saddle joint. So when we're working this adrenal gland point, we're getting the reflexive effect as well as the direct effect. On the ear, the adrenal gland point is located on the tragus. So we can hold with our thumb and index finger, and there's a lot of points here, but you can either hold, or you could also use your index finger and kind of point around on there. I like to put my thumb behind the tragus and use my index finger. So again, on the ear, we can find our adrenal gland point. Here it is on the ear model, and then here it is on a person. And now again, if somebody didn't want to walk around and everybody knowing that they're wearing ear seeds, you can get them so they're not visible. I just use the ones with crystals so that when I'm giving a presentation like this, it's a little bit easier to see. So now as we look at stress, we saw, how do we find the adrenal gland? On the foot, on the hand, and on the ear. So from stress, we move into, if people aren't managing stress well, how are you doing with your food consumption? What's happening there? So I like to kind of address that just to bring attention. So as massage therapists, we're not doing diet plans, but we certainly can share information about the appetite control point. So this is kind of fun because this is not a reflex point, but a Chinese point. This would be an acupressure point from the opposite ear model. So this point is also located on the middle of the tragus. It's a little closer to the face, and it's a little bit higher than the adrenal gland point. So right here in red, that was our adrenal gland point that we just talked about for stress management. And then right here in green, that is the appetite control point. So again, we can hold this with the thumb and index finger. We can just simply massage it. We could use those probes that I showed you a little bit earlier. And if licensed, we can use electrical stimulation or needles. So here is the same picture, but a little bit larger for you to see. So again, if you're really interested in learning the Chinese points, you can get these ear models. You can start seeing the points on the model and then start doing it on yourself. So then movement, right? So how is your stress? How are you eating? Are you moving? We're all hearing that, sedentary lifestyles is worse than a lot of the other bad habits that, we want people to change, because when we're sitting, we're not moving. We're kind of holding those isometric contractions. Our lymph isn't moving. Blood isn't moving. We get pain. We get stiff. The muscles shorten. You know the story. So from a movement perspective, I picked the shoulder. And the reason being, because we're all on our devices and so many people are having neck and shoulder issues. A lot of people don't realize it's the shoulders that are causing the neck issues. If we don't strengthen the neck, the shoulder, it's all connected. So you could really pick any body part, but because so many people are complaining of shoulder pain, that's what we're going to look at as we're thinking about reflexology, auriculotherapy. So the shoulder is located on the outside of the foot. So here again, we have a reflexology chart. We see the shoulder. Here's the shoulder. If your foot is handy, go ahead. If you have shoulder issues, and palpate that area on your foot and see if it's tender. On the hand, we can see the dorsal surface of the hand on a chart. Here, we saw the shoulder line is right in here because the shoulder is a big complex. It gets an area, not just a specific point. And then here it is on the hand. So we could go ahead if you have shoulder issues and stimulate this, because we know sometimes when people come to us where they have pain, the shoulder might just be too sensitive. So let's try to affect the shoulder using the hands, using the feet, using the ears. So when we're talking about the shoulder, we're back to reflexology. So this is the ear model where you can see it says head, here it says shoulder. So again, I can massage this in the session. I can massage it on myself. If I want that prolonged stimulation, I can then place an ear seed. Again, one that's invisible for our demonstration purposes, and or if people are into also doing color therapy, we can choose crystals that are resonating with colors that are important to them. And now here's where we get to come back to trigger points. So we talked about trigger points. We talked about tender points. Somebody comes with shoulder pain and they say, I want you to massage out here. Here's where it hurts. We always want to listen to clients. We want to do what the client wants, of course, but we're going to just navigate over here to the anterior deltoid and just see if there might be a trigger point. So again, what is a trigger point? It refers pain. How do we find trigger points? Use charts. Use your trail guide to the body if you have that book. If you have a different, Travell and Simons, there's so many wonderful publications, and they all have the trigger points in the same spot because, again, it's predictable. It's reproducible. So people will often ask, how do we treat trigger points? Well, we know direct pressure, as we talked about, 3 to 4, holding up to 2 minutes. But here are some other really big things. If we don't change our diet, if we're not moving the shoulder, if we're not paying attention to posture, managing stress and sleeping, the trigger points are going to come right back. So it's so important that we educate ourselves, educate our clients that really when we have pain in the body, we need to integrate all of the things that we're talking about together tonight. Otherwise, that pain is just going to keep coming back. And then as body workers, we're frustrated, as clients, we're frustrated. Again, we can use tools to also help. We can use foam rollers and we can use kinesiology tape. So this taping picture that I'm showing you here would be, this application would be if there's also swelling in the shoulder. If it was for a trigger point application, the tape would get applied differently. But a lot of times when we surround this whole deltoid muscle with a swelling or an edema application, a lot of times because of that light pressure, it helps those trigger points to not come back. And then if you've studied trigger points, it would be negligent if I didn't talk about, we have to stimulate and stretch, because we know if we don't get those muscles to get their full range of motion, the trigger points just go right back. So we want to be able to use our reflexology, our auriculotherapy, our trigger points and direct pressure all combined together to help this shoulder. So when we summarize it, we saw the foot, we saw the hand, we saw the reflexology point on the ear, the trigger point, and the taping. So now if we, have issues with how we're eating and how we're moving and stress, a lot of times we don't sleep well. So we need to address all these components to really help our clients. And so this becomes kind of where we can pull in some of our Eastern knowledge. We can revisit the meridians. So again, on the meridians, that's where we have the acupuncture points. Again, a lot of times we use more than one point. So if you're an acupressurist out there, I don't want you to think I'm oversimplifying. I'm just trying to show, sometimes we can pull out these main points to teach our clients so that they can use them at home. So I like to refer to if we're using just one point as a power point. And so when we talk about a point for sleep, we're talking about liver point 3. And so if you've studied the meridians at all, the liver meridian has 14 points. It starts on the foot and it travels up and it ends right below the nipple area. This point, the liver and gallbladder pair together, the motion is anger, and the point that we want to use for sleeping is right here, liver point 3. So we're going to massage it. We can help stimulate it. So it can help often with unexplained insomnia, stress, anxiety-related sleeplessness, headaches, and irritability. It's located on the top of the foot, right in the valley between the big toe and the second toe. This is also, if we study reflexology, where there's a lymphatic point. So again, we're hitting a reflexology point, we're hitting a meridian point. So when we said before, these things overlap, it's amazing and just so much fun to make these connections. So we find this point then by simply finding where the skin between the big toe and the second toe connect, and we can apply pressure up to 3 minutes. So again, we could use our thumb, our index fingers, our knuckles to stimulate that point. So now, in addition to the foot, kind of staying with our Eastern tradition, we're now not looking at body parts or reflexology parts on the ear, but we're looking at Chinese acupressure points. So we have 2 points that correspond to insomnia that, again, we can hold with the thumb and the index finger to massage, or wonderful opportunity for ear seeds, because as people are trying to fall asleep, just by the nature of these points being on the ear, they're stimulating that point. Again, on a 1 to 10, 3 to 4, if we feel like we want a little more stimulation, we can reach up and we can press those points. So when we're thinking about some, hacks for insomnia, these are some points to try on yourself or to share with other people. And then we have to address pain. So many people have pain. We really want to make sure we're asking about where is the pain, all of those questions that we learn. What type of pain? Is it stabbing, shooting, hot, cold, so that we can help with pain? For now, tonight, I want to talk about headaches because, again, we're spending time on our devices. We're being more sedentary. So a lot of people are, expressing that they're having headaches. So if we think back to our anatomy, here's our shoulder line, here's the shoulder line. So the fingers and toes are where we find the head. So people can massage their toes, which is great anyways, because we know for balance and proprioception, we need our feet to be mobile. And so many people have feet that don't move, that if we can encourage people to move their toes by grabbing onto the tips, not only might it help headaches, but keep, again, the direct effect of the synovial joints healthy, things moving. So again, we have those reflex and direct effects. If they don't want to do it on the feet, we can do it on our fingertips. And so again, stimulating that, just kind of grabbing on, is really powerful. And on the thumb specifically, we know kind of right in the center of the thumb, that's where the pituitary pineal hypothalamus point is located. So it's never a bad idea to give your fingers some attention. Then from an acupressure standpoint, we have a potent point that we're going to now look at in depth. The headache point is on the large intestine meridian and it's on the hand. This point is a pretty famous point. It's taught in polarity. It's taught in almost every modality because it's so effective. So this point for headaches, it's on the large intestine meridian that has 20 points. The flow of this meridian is from the hand up to the head. It starts on the index finger and it ends at the nostril. It's active 5 to 7 in the morning, and the emotions associated, all the meridians have emotions, is grief and sadness. So this point we find between the thumb and the index finger. It's a great point if you're having a headache, toothache, even potentially shoulder pain. So on the dorsal surface of the hand, right in that webbing. And so again, a lot of people are really familiar with this point. Often it's listed as a contraindication for pregnant women because a stimulation potentially could cause uterine contractions. So always, with all of the things that we've been talking about tonight, we always want to get a note from the obstetrician when we're working with pregnant women to make sure that what we're doing is safe, effective, and right for them. But otherwise, it's wonderful to stimulate that point. And then with the ear, we get to go back to reflexology. Remember when we saw the first picture, the head of the fetus was here and then the body was curled up. So stimulating anywhere on the earlobe is really wonderful for headaches. You really can't go wrong. If your ears are pierced, you can just simply massage around the piercings. Sometimes people will want to take their earrings out before they do the earlobes. That's great. But sometimes from the piercing, some people will have scar tissue. And then when they're massaging that, the scar tissue might feel a little bit uncomfortable for them, or it's just a little bit creepy. Then you can just put your earrings back in. But go ahead and massage your earlobe and see if it helps if you suffer from headaches. So when we put this all together for headaches, we then saw the toes, the fingertips, this LI, large intestine 4 on the hand, and the ear. So this brings us to where we started when we were saying, let's start doing some application. So again, we addressed stress. We talked about food consumption a little bit with that appetite control point, movement, sleep, pain, and breathing. And now if we put everything we've learned, we're looking at what I just had up, but now everything on one slide. So if you just look at this one slide and you're thinking, oh, stress, the adrenal gland, here it is on the foot. Here it is on the hand, and here it is on the ear again in red. If you're thinking, wait, what was that about that appetite control point? Here it is. For movement, we said shoulder. So we looked at the shoulder points for reflexology on the feet, on the hands. We looked at the trigger point in the deltoid muscle, and then reflexively where that shoulder is shown on the ear. Sleeping, because it's so important, insomnia, we looked at the liver point 3 between the big toe and the small toe. And then we said from an acupressure standpoint, we have 2 points for insomnia. And then we talked about pain and headaches. And we said, again, the toes, the fingers, the hand, and the ears. So I hope as you're looking at this slide, you're kind of seeing how we really can integrate our Western anatomy and physiology, translate that to reflexology, looking at our meridian, our Eastern information, letting that layer in, and then looking at some of these additional modalities. We don't have to use them all at the same time, but it's nice to know that we have a lot of tools that we can use to help people. So again, I really want to thank you, Donnell and Biotone, for having me tonight. It's just such a wonderful and exciting opportunity to be able to be here. And if you've enjoyed getting to know me as much as I've enjoyed my time with you, I want to thank you for attending the presentation. If you want to learn more specifically about what we offer with reflexology, you can scan our little flow code. If you go to our website, you can sign up for the newsletter. We'd love to have you. We have free classes on our website. We have a lot of different domain names that we own. So foxvalleyschoolofmassage.com, stephanielynhall.com, they'll take you to the same spot. And in addition to the free classes that we have, we also offer professional certifications. So we've got professional certifications in reflexology that includes the auriculotherapy and introduction. We have Feng Shui, we have you can tape kinesiology taping. And for attending tonight, I want to thank you for your time. We have a special offering on our reflexology certification. So if you enroll in our reflexology certification between now and next Tuesday night, and you use the code EduTalkReflexology, you can save 30% when you check out and pay for the course in full. We have videos available also on YouTube. So if you're wanting to look a little bit more in depth at specific points, we have some of those out on our YouTube channel and on our website for reflexology. And also, I'm so fortunate, I will be back again on April 18th, where I will be able to share information on Feng Shui. So I just want to thank everybody for attending and thank you for this opportunity. And I look forward to some questions and spending some time answering them.
Thank you so much, Stephanie Lynn. Excuse me. And I mean, you covered so much information and it was really fascinating. A question came in from Susan. Any suggestions for neuropathy?
So are we talking about neuropathy of the feet, hands, feet? So a lot of times there's been some really great research with people that have diabetic neuropathy in their feet and wearing wool socks. So if that is not something, alpaca socks, wool socks, always giving those body parts a lot of attention. So if there is peripheral neuropathy, making sure that we're doing massage, that we're doing range of motion, maybe rolling the foot out on something soft, making sure that we're getting the feet up. So it's great to have the feet down, having the feet up, encouraging blood flow. If that's a secondary thing from medication, diabetes, it's hard to reverse those things, but then our primary goals become trying to make sure that it doesn't get worse.
All right, and I'd like to answer John. He was wondering if he'd be able to replay this for workmates. And John, tomorrow I will be emailing out a follow-up with this recording tonight, a link to the recording, and a copy of Stephanie Lynn's handout. So definitely you'll be able to share that with your workmates, as well as on biotone.com under the EduTalk tab in the archived library, it will be posted there as well. And I had a question for you, Stephanie Lynn.
Sure.
I've seen, I mean, just over the weekend, I saw someone with an ear piercing where it looked like the diet point was. And I just wondered, I mean, aside from the scar tissue, does that affect, I mean, is it constantly stimulating that?
No, that is the most perfect question. Thank you so much for asking. So what you saw on the tragus is a lot of times people will get that area pierced if they have a lot of migraines. There's a specific migraine point there. So what happens, unfortunately, with any of our piercings, so I wish I would have known this when I was a little girl. Once we pierce something, we have initial stimulation for like a day or two, but unfortunately what happens after that is it deadens the stimulation of that point. So all these people that are getting their tragus pierced, most of them, so not everybody, because again, there's always individual variation, but most of them will have relief from their migraines for a little while and then they come right back. So instead of piercing that point, that's where ear seeds, vicarious seeds, stimulating it, massaging it is so much better because we're not taking that point out of the picture and it stays available for us to be able to work on. That is like a perfect question.
Oh, great. I haven't noticed any other comments. Yes, thank you. A fellow Wisconsinite.
Yay!
Ha ha ha. And that the presentation was wonderful. So I haven't seen, oh, wait. Something else came in. Let's see if I can get there. Okay. Would somebody with large ear gauges have related problems? So you know what those are, the big rings in the earlobe?
Yeah, so it's kind of interesting when we look at, you know, some of the complementary and alternative modalities. Alternative dentists will say, like, if we have a root canal in a certain tooth, that potentially it can cause problems in other areas of the body down the road. So when people have spacers or things in their ears, I don't know that there's been any studies done yet to see if by spacing that would potentially cause more headaches or toothaches. So I think that we're going to just have to wait and see as more people have spacers, if they start to report problems, or if it's just that we can use the ear to help with those things. So that is an excellent question.
Oh, great. Well, I'm not seeing any others come in, just a lot of thanks. And I would like to take a moment to let folks know in the EduTalk archived library on biotone.com under the EduTalk tab, we have had some presentations in the past that tie into Stephanie Lynn's presentation tonight. There is color aromatherapy. There is acupressure. There is another reflexology talk from a different point of view. And I'd like to mention that coming up, we will have February 7th, Ann Williams with putting therapy back in aromatherapy. On February 21st, we'll have Janet Wolf-Blevins with acupressure for grief and lung and large intestine channels. And then March 7th, we'll have Kathleen Leeson, mindfulness for the massage therapist. So we have some upcoming talks that can complement your presentation tonight. And in the archive library, we also have additional talks on some of the topics you touched on that can continue to present information to everyone who's attended. So thank you. And again, April 18th, Stephanie Lynn will be back and presenting on Feng Shui for health, wellness, and productivity. So watch your inbox, not only tomorrow and your spam box, for the follow-up email with the presentation and the recording link, but also for future edu talks that are coming up. And thank you so much for joining us, and wonderful presentation. I'm not alone in that. Thank you so much, Stephanie Lynn.
Thank
And
you.
everyone, thank you, and be safe. And join us again for our upcoming edu talks. Take care.
Good night, everyone.
Good night. Thank